And we've seen the amount of work and energy that the state government has actually put into rehabilitation of those primary health centers. Now, what actually informed this? Why is primary health care, in the top front burner of Ogun State government activities in the health sector?
If you know, nationally, the healthcare delivery system is a sort of pyramid, and most grassroots people would access health through the primary healthcare centers and then referred to the general hospital, the state hospital, and then the teaching hospital, which is the tertiary center. So in order for us to be able to make a dent in the health statistics of the state, His Excellency Prince Dapo Abiodun knew that it was crucial to his administration to address the primary healthcare center. Also nationally, there's the Basic Healthcare Provision Fund, which has been made available for all states to access to provide good healthcare, quality, accessible healthcare for the people of Nigeria. So in marrying these two visions, His Excellency actually committed at the very beginning of his administration that he was going to ensure that in Ogun State that we had 236 primary healthcare centers across the 236 wards in a functioning state, in a conducive state where people are happy to access health. Because if you look around the primary healthcare center, most people don't go there, they go privately. And we want to turn that scenario into the fact that most people will go to the government primary healthcare center to access care because the environment is conducive, the care is of quality, and the one that you and I will be proud of to actually use.
For now, it's one in each local government, 20 local government areas of the state.
Obviously, go on.
Okay, and the promise is that there will be 32, 36 at the end of the 4-year term of this government. How do you plan to do that? 236 in 4 years?
Well, this is the first phase. We've done one in each local government, 20. And actually, we were going to do 50 in this first year. Okay. However, because of the other health crisis, the pandemic, coronavirus, which has actually consumed a lot of the budget, because we made a promise, we were determined to keep that promise. So His Excellency made sure there was funds available to actually renovate and equip those primary healthcare centers. The next quarter, our hope is that we're going to do another 50. If you put it quarter by quarter, that's every 3 months, doing 50, 20 to 50. I'm sure in 4 years we would have gone around the 236.
Now, I'm sure you must have gone around all of these areas where we have the primary healthcare facilities located. How will you describe the state, really, of primary health care when you assumed office as commissioner for health in the state?
The minute I started, I think even before I was sworn in, I went around a few. And since I started the job, I was sworn in, I've been to probably altogether about 40. But the theme was consistent. The infrastructure was dilapidated. There was not enough staff. The security of the staff was also jeopardized because there were no perimeter fencing. The patronage was low in some areas because obviously if you've got a dilapidated structure and you have competing private hospitals in those areas, people were more likely to go to those private areas. So really, as His Excellency declared at the beginning of his administration, the state of health in Ogun State was in crisis. But we are determined in this administration to change that landscape, to change the story of the healthcare system in Ogun State.
Now, your target for the first phase is 50. So when really are we looking at, for this first 50 to be completed?
As I said, the next 3 months, we're hoping that's the second quarter. We're hoping to do another 50 as we promised. So hopefully by the end of the year, we should have a minimum of about 80 to 100 that we would have done.
Now, an average health center, what should we be looking forward to see in an average health facility at a primary healthcare level?
Okay, what you would, infrastructure-wise, you would have a male and a female ward. There will be services for both male and female. In the past, health centers were seen for delivery, women going for their antenatal, the children going for the immunization. But because we want this to be the first port of call for every single citizen, both male and female, young and old, we have expanded the service to include antenatal delivery, immunization for 0 to 5, common ailments like malaria, diabetes, hypertension will be looked after in our primary healthcare centers. Therefore, you will find that in there will be a family planning service, both for male and female, because it's not just women that need family planning. You would have a doctor sometimes, if there are medical officers of health that will be doing their rounds around the primary healthcare centers to provide advice to the apex nurse as required. And there will be a minimum of 2 to 3 beds in the male ward and about 5 beds in the female ward to actually accommodate admissions when necessary. So those are the things that we're hoping that that we've provided. We've provided also brand new equipment, surgical and medical equipment, and brand new beds and furniture for every single primary healthcare center, which we have refurbished apart from the infrastructure. And long term, we are hoping to recruit health personnel, because buildings and equipment don't make a service. It's actually the personnel that make the service. So our strategy is to drive recruitment from the community around the primary healthcare center so that there will be sustainability. At the moment, people are traveling from far to come and work in the primary healthcare centers. But we felt that if the staff are from that community, they can drive traffic into those healthcare centers. And the likelihood of because they're invested in the project, the likelihood that they would stay is higher, and the attrition rate will be a lot lower than we experience in the moment.
Are you also thinking of, are you not going to run into the danger of compromising professionalism or qualification? If you say you're going to, for instance, I don't want to mention any particular local government, but we know there are some local governments that are, still generally rural. Are you sure you're going to have, competent people from those communities to run the facilities?
We are in no way going to compromise, professionalism or quality of training. What we're going to do is look for people who qualify. We're not just going to employ people just because they're from that locality. We all have to travel to get to work. Where we cannot actually sustain, that, there are accommodations for doctors and nurses. We've actually to ensure that we have residents for both the nurse and the doctor. So if they have to travel far, they have a convenient accommodation where they can stay in, and they do a 7-day shift. That's the sort of thing that they do.
Is that going to be consideration for, special consideration for some local governments? For instance, Adodota is huge. And so in staffing Adodota, if you have a primary health center in Adodota, in staffing it, in comparing a center in that local government with one in Imekwa, for instance, is it going to be the same number of staff, the same number of attention, the same attention, and all of that?
Part of our strategy for health is standardization, making sure that the equipment, the infrastructure, and the staff, the workforce is similar. Obviously, the volume drives the number of staff. Where you have about 100 deliveries occurring and where you have 10 deliveries occurring, you would staff the facility in a ratio that makes sense. So Sangota is a huge primary healthcare center. It's one of the ones we have renovated. Obviously, we have 13 beds there, whereas in some primary healthcare centers, we have only about 8 beds, and in some even fewer. So the staffing will be the same. It will be commensurate to the number of the amount of workload that they are doing there. But quality, we will not compromise on. We would hope to actually have the same quality of staff there. in the bigger picture and in the long run, what we're hoping is we can actually attract youth corpers into those primary healthcare centers, because I remember when I was doing my youth corps many years ago, youth corpers used to be posted to the rural areas, and they were there for a year. And that gave the consistent, level of care that one would expect, rather than just having the choose the community extended workers alone looking after women. When there are complications, a doctor can be recruited into the management of the patient and actually triage and escalate and refer appropriately to the general hospital. We're also hoping that with the structure that we're developing, which is the hub and spoke structure, and with the IT infrastructure we're hoping to include in the primary healthcare center, there will be a standardized management, because all the nurse or the midwife needs to do is ask the questions, enter the answers, and there will be an algorithm that informs their decision. So the decision-making tree leads them to the correct investigation, correct diagnosis, and may even suggest the sort of drugs that they should give. And if there's a need for referral to the next tier, it will prompt them to do so. Once we get that infrastructure in, then the quality of care is standardized, and you get the similar outcome across all the PHCs.
Now, with this electronic that you are trying to introduce to the process, I'm sure you're also putting into consideration the challenges of the rural areas, where you have poor network, and then you have power issues. I mean, I'm sure you have that at the back of your mind too.
Certainly. What we've done to overcome the power issue is actually to put solar panels in all the primary healthcare center, because we want our primary healthcare centers to be the focus of the community. So 24/7 power is the plan, is what we plan, so that the people naturally will gravitate towards the primary healthcare center, which will make it easier for them to use it. The model is, if you want to charge your phone and you're in a village, you know that you can go to your primary healthcare center, there will be light 24/7. That would make them come naturally there, so when they need the services, they know where it is. So we intend, with the network issue as well, there will be obviously technology to ensure that we have network. However, these ICT platforms do not actually need network as such, because they upload as you have network. So it will store all the information and upload where there is network.
Now, let us also look at the issue of how affordable these health services would actually be. It is one thing to have the facilities, to have the personnel, and then there's also another thing for the people to be able to access these health services at a cheap and affordable rate. World over, health is one of those things that it is advocated should be cheap, so that everybody can access it.
We do acknowledge the fact that health is a social service, so we're not intending to make any profit. But the good news is, with the basic healthcare provision fund that I mentioned, it means that care, antenatal care delivery will be free. Health services for children under 5 will be free. The treatment of malaria, uncomplicated hypertension and diabetes will be free as well. And Ogun State, in the next 3 months, we should be signing up to this, and we're hoping that before the end of the year, definitely, we should be seeing this free services at our 236 primary healthcare center. Whether we've actually refurbished it or not, this will take place, because we've already trained the staff at the primary healthcare center on how to access this fund. And also the CDC leaders have been involved, the community have been engaged in the training to actually tailor their work plan to the needs of that community. If they need certain drugs, they can buy their own drugs. If they need to employ certain groups of professionals with the money coming from the basic healthcare provision fund, they can act on a monthly basis. It's a regular impress every month, that would come to them, that they will be able to manage their own primary health care centers to actually meet the needs of that particular community.
What about the insurance scheme? Is there any nexus?
Yes, the insurance scheme also is coming into play. We are going to launch in the next sort of 3 months as well. We're going to launch that, firstly in the formal sector. And what the insurance scheme actually affords you is what is not covered by the Basic Healthcare Provision Fund will be covered in the insurance scheme as long as you are signed up on the insurance scheme. Advice to everyone is the insurance scheme is very cheap. It should be very affordable. We should sign on to it because it gives you access to the primary healthcare centers where you don't have to take any money out of your pocket. And even at the secondary and tertiary level, it gives you about a 50% discount on whatever service you access. So we are encouraging every citizen of Ogun State to sign up on the health insurance scheme when we have launched it.
The past immediate part administration actually launched one called Araya scheme. What has happened? We thought there should just be seamless consolidation. What has happened to that?
Araya was not funded from the federal government. The Basic Healthcare Provision Fund and the insurance scheme, this is coming, the funding is coming from the federal government.
Okay.
And because of the design of the scheme, it met some challenges. It wasn't sustainable, and unfortunately, it's fallen by the wayside.
Okay, now, whether we like it or not, COVID-19 is still going to be with us, even after the curve will have been considerably flattened. But how does primary health care, in Ogun State, the plans of this government, how do the plans of the state government in this area come into play post-COVID-19?
So we're about 100 days into COVID-19 now.
Yeah.
And we've have a lot of experience. We've learned a lot about it and the pattern of the disease in our community. So we've realized that it's not going away soon, but we have to then adjust to our new norm. So from the Ministry of Health, we've decentralized our sampling, and we've trained our primary healthcare workers on how to recognize an individual that we may suspect to have COVID-19 symptoms. That training, they've done the trainer course about 3-4 weeks ago of 200 people. And this week, we're going to start the training of the first batch out of the 2,400 people that are going to be trained on how to identify a suspected case in the community in that PHC. So we're integrating the care of and diagnosis of COVID-19 into our community. So anyone can go into their primary healthcare center, be identified, and samples will be referred to the right facility where samples will be taken, and they can be managed within what we call community-based management treatment, which could be in the home or in a isolation treatment center in their vicinity.
What will Ogun State become, or would have become, at the end of your administration, if all these centers are in place, functional, equipped with drugs, with personnel, and with all of the sophistication they have actually promised?
Our vision, and mostly Prince Dapo Abiodun, the executive governor of Ogun State, his vision is actually to see a healthier Ogun State with our life expectancy increased from the 53 that it is at the moment, to have a decreased maternal mortality rate, to have less communicable diseases outbreak in our children, and also to have a fitter, healthier community that is now economically empowered. As they say, health is wealth. So the fitter we are, the more we can contribute to the economy of the state in general.
Now, when we talk about anything, really, there are always models. And then when we look at primary health care, you talk about models, you talk about countries like Cuba, you talk about countries like Thailand, and then there is something that is consistent, in these two countries. That is their involvement of the local community in their primary healthcare service delivery. Now, is that why you said you are going to be taking your employment really from the community, or do you have any other plans really to further integrate members of the community, traditional rulers in the community, to ensure that the healthcare at that level is really up?
If you look at Rwanda, let's say we don't go to Thailand and far places. Rwanda is nearer, which is Africa, and Rwanda has been very successful in its primary healthcare facility, healthcare delivery system, because they've included the community and, as you said, traditional rulers. Also, if you study the constitution of the CDCs and CDAs, they involve leaders within the community. That's why the Healthcare Provision Fund has actually pulled people to train from the CDC. And the step-down training that we're going to do in the primary healthcare facilities this week actually includes local leaders, community leaders, to ensure the sustainability of whatever we are training people, because you can't impose top-down. You have to let things germinate organically from within a community. When that happens, they are the ones that will ensure that the healthcare system is of the quality that they desire. And ours will then be a job of oversight rather than driving it. It will be driven from the grassroots itself.
Now, recently we had a report that Nigeria is having increase in mortality rate, child mortality rate, maternal mortality rate, as a matter of fact, simply because of the shortage of midwives in the country. And of course, Ogun State is also in Nigeria. So it means that if there is shortage of midwives in Nigeria, Ogun State is also in one way or the other affected. Do you have plans really to ensure that we have those who are specialists really in terms of child delivery? Because at that primary healthcare level, at the local government, one thing is constant: people will always come for child delivery, and then there will be complications, and then you will need professional specialists to really handle these cases.
So the thing is, generally, if you look over the last 10 years, the maternal mortality in Ogun State and in Nigeria has been on the downward trend. However, with the recent COVID pandemic, because of the lockdown, lack of transport, there's been an acute rise in maternal mortality and outbreaks of communicable diseases like measles and polio in children. So what, number one, the immediate need is for women and children, and women and their husband to know that the primary healthcare facilities are open for all the services, the antenatal care, delivery, family planning, and immunization, routine immunization. We are open, we are functioning. The lockdown does not affect the primary healthcare services. Even on the Saturdays and Sundays that we are that there is lockdown, those services are open. The card, your hospital card is your pass to move around. So do not hesitate to access the primary healthcare centers. But going back to the question that you raised, there is a plan, but all these plans have to be long-term. Ogun State has a postgraduate midwifery, post-qualification midwifery school. But we have decided that we're going to go to the basic, convert it to a basic midwifery school, so that we can admit more people and grow our own midwives that we can then employ within the state. So that is our long-term vision for sustainable supply of healthcare workers in our primary health centers.
Okay, we can't, but I don't know, you can't come here without talking about COVID-19. 19 new cases were discovered yesterday, right?
Yes.
Is there any reason for for people of Ogun State to fret over this?
I wouldn't say
Same thing
so
last week.
because, sorry?
Same thing last week,
Same thing.
19.
We had
Last week.
34. We had our highest. There was one day that we had 34. We had our highest number in a single day. But there is no reason to fret. The more you test, the more you would find. But the good news is most of our cases, 97% of our cases are actually asymptomatic or mild disease, which means that has informed our decision to move our treatment, rather than treating people in the treatment center, is moving our treatment to the home-based treatment, which means we can cover more people at less expense, and people are not sort of dislocated from their own setting. We hope to do more tests. That's the strategy for the country. If you look at us compared to other African countries, Nigeria is behind in the number of tests, and the national strategy is every state should at least do about 50,000 tests. But that involves manpower and also cost. We do have the capacity in the state to test 600 a day. We'll be hopefully ramping up more of our tests. We will see more cases, but it's the outcome we should look out for, not just the number of tests. I would say look at the outcome. How many people are being discharged and how many fatalities. We are very fortunate that our fatalities are still low at about 12. It is 12 as of today, and 13 actually, because there are 13 cases, but consider that we have over 300 cases and we have 13. The percentage is round about, about 3%. So, whereas...
In the papers this morning, Punch specifically said crisis looms as we are short of bed space in the country. Well, you are the Commissioner for Health in Ogun State. What is the situation of things?
I am pleased to tell you that in Ogun State, we are not short of beds. The occupancy rate of our beds is 20% in Ogun State. We've only activated 2 of our isolation centers, and they're not even full to capacity. As I said, 20%. We have over 300 beds, and at the moment we have less than 70 patients on admission.
Are you willing to help other states?
There is the possibility. We're looking around Adodota and seeing what we can, it's our highest incident area, and we're looking at how we can actually put an isolation center and support Lagos, because there's also...
Now, what else really is going to be happening in that Adodota? Because if you have a local government that has such cases in a state, it is actually dangerous to local governments that are close to that local government, and then there are also other local governments that are close to Adodota. So what are you really doing in that Adodota?
Adodota is unique in that it's the only place where we have a permanent booth that is tested. So without any doubt, you're going to have more cases. And also, it's our local government that is nearest to Lagos, where people travel to work in Lagos. So the combination of the two is why we have that large number. But the important thing is to know what our risk is there. And we have deployed our contact tracers and sensitization. It's going into that community and ensuring that people are being sensitized continually that this disease, it's not gone away. Yes, the lockdown has been relaxed, but we have to continue to be conscious of the fact that we have to keep our personal hygiene, respiratory hygiene, the social distancing, and the wearing of the face mask, because this virus cannot proliferate without a host. And when you distance yourself, there's no host, and the virus will eventually die a natural death.
Commissioner, as we're closing this interview in 2-3 minutes, I would like you to ask, because this government has marked a year in office, we just want to ask you, scaling up healthcare delivery in a state like Ogun State, is it a sprint or a marathon?
Well, from what we inherited, I would say it's a hybrid between a sprint and a marathon, somewhere in between.
Okay.
There's a Yoruba saying, "Ibikpelebe, not in moleje." So which means you take a step at a time, and when you do that, what seems to be a mountain then becomes achievable. So naturally, I'm a half cup full individual and not a half cup empty. So what someone would see as a challenge, I see as an opportunity. And it's always important to keep the positive, mindset, so that you don't get overwhelmed by what you see. Because if you do a little at a time, we've done 20. Another 3 months, we do another 50. We change the general hospitals, we change the teaching hospital. By the end of 4 years, we'll look back and think, wow, even the last 1 year, when we look back, we think, wow, we've acquired, 14 ventilators altogether in the state. Now we have 24. We have a dialysis machine, ultrasound machine. We have 2 mobile X-ray machines, all in a short space. A lot of medical equipment, but we've done it a day at a time. So I don't think it's insurmountable. It's an interesting challenge.
Okay. We are not Nostradamus, the man who saw tomorrow, but we're trying to look at. Not really talking politics now. Let's assume this government gets another term of office, 8 years. Where will this sector be?
Oh, definitely 8 years. We would be 8 years. The healthcare sector of Ogun State will not be recognizable. Okay. In that, we intend to make Ogun State the health tourism destination of Nigeria, which means things that people will go to India to seek health service, renal treatment, renal transplant, cancer service, pediatric service. We hope, by the grace of God, that we can, improve all those services, that people will be coming from other states to come and seek their health care in Ogun State, if God allows us to have the 8 years. Okay,
we must thank you so much, Honorable Commissioner, for coming on this program. We've been hosting the Commissioner for Health in Ogun State, Dr. Tomi Koka. We'll be looking at efforts of the state government in the area of primary health care delivery. And we've also moved to COVID-19 a bit, and we've also looked at the bigger scale of healthcare delivery in Ogun State. And we just want to believe the Commissioner, that at the end of 4 years of this administration, will bring her back, and we'll again assess all this government has done within that period. We must thank you so much for coming, and wish you the best of luck. You spent a year on this seat already. Best of luck. Dominic, we've got to go. Yes, we've got to go. We thank you so much also, our viewer at home, for staying tuned on the program Newdawn. That's the size at the size of the program this morning. I'm Dominic Agbeha. On behalf of my colleague Biodo Alabi, we are saying have a wonderful day and ensure you stay safe. Okay, just before we go, sorry, this is the breaking news. Report just coming in says that Abia State Governor Okezi Ikpeazu has tested positive for COVID-19. Commissioner for Information John Oki Kalu announced this this morning. We just like to tell you that COVID-19 is still real. It's still very much with us. From Abia State, I'd like to repeat, Abia State Governor Okezi Ikpeazu has tested positive for COVID-19. Okay, we'll close the program this morning, Newdawn on the People's Tele. We'll catch you again tomorrow. God willing. Thanks for watching us.